So this policy about the leave or it will be benefited for the employee and it will boost some motivation to do work or to focus on that particular work after the break. Now let us discuss about the objectives of human relations. First is the practice of good human relations. It aids human resource management. So why I am talking about the human resource management? Because if the boss is good, then obviously the employee, they will be more benefited for some, they will be more motivated to do the work. Okay, and it will improve the recruitment process also. And the turnover rates of employee getting retention will also get decreased. Secondly, it establishes a coordinated relationship between the management and the employees. So the employees who are working under a particular institution, so they will be benefited and they will maintain a good human relationship among themselves. And last, it will improve the teamwork and team spirit. So working in a hospital setting, we need to do the teamwork. For example, suppose our nurse is posted in an emergency ward, and if our case came like suppose an unconscious patient suddenly got collapsed, and immediately the nurse and the entire team need to be CPR to save the life of the person. So in that case, if teamwork will be not sufficient, then obviously the life of the patient will be in danger. So a proper teamwork and team spirit we need to maintain in every cases we are working. And so for maintaining this relationship, we need to know the proper communication and about the human relationship. Now let us discuss about the goals. So firstly, it helps to gain a better understanding of one. So in emergency situations, as I have given an example that a nurse was posted and she has got an accidental case or a CPR she has to give. So in that case, if the nurse gets panic or suppose if she don't have confidence to give CPR, then obviously again the life of the person will be at risk. So in this case, whether the nurse is confident enough or whether she is very nervous to provide CPR. So in that case, it helps later to understand herself about herself that whether how she is better in providing CPR. So it helps in understanding about herself or himself, how she tackles in any kind of difficulty. Then respecting others. So irrespective of our positions, we need to respect every individual. We need to follow the dignity. So basic principle we used to follow whenever we are posted, we need to visit a patient suppose. So our basic value says that knock the door before entering that cabin. So this is a basic moral value or the dignity we are following every day today. And we need to respect everyone irrespective of our positions. Not that someone is in a higher post and he or she will not behave properly or expect the lower level degree post. So it's not that thing, and we are every day following this kind of things. Thirdly, to broaden our certain sensitivity to the feelings of others. So whenever we are dealing with the nurse or suppose the patients, we are every time trying our best to give our good values to them and to understand their condition. Let me give an example how we can understand the feelings, like a female nurse is posted and suppose that day is her first day and she is posted in chemo ward suppose. So today is her first day and she was posted in chemo ward and she has no idea regarding chemo drug or suppose extravasation. One patient suppose he is suffering from extravasation and she initially in her initial phase she complained, not complain actually, she tell her senior nurse that a patient is having extravasation. So what measure I can do? So in this case, the senior nurse, instead of criticizing her in front of others, she should explain her that this is the case of extravasation. You need to manage these things. So in this case, she can understand the junior nurse feelings and emotions, and then she can give her some appropriate measures to improve the extravasation. Since our main goal is to improve the quality care of the patients, right? So till now, this clear.